Some people have no symptoms and others feel like their heart is flip-flopping around in their chest. They're weak, short of breath and tired all the time. It can come and go or be permanent. We're talking today about atrial fibrillation. So, who gets it? How can we prevent it? And if you have it, can you get rid of it? Stand by, Go Healthy for Good starts right now. Hello and welcome to Go Healthy for Good. In a normal heartbeat, an electrical signal travels from the upper chambers of the heart to the lower chambers, triggering sequential muscle contractions for pumping blood. In atrial fibrillation, electrical signals fire from multiple locations in the upper chambers, resulting in chaotic heartbeats and sluggish blood flow. Today's story is from Glenn, who got a wake-up call about his heart very unexpectedly. Watch.
I was always active or always involved in sport. I got married fairly soon after becoming a pastor, and I was in my early 20s, and Pam was basically a vegetarian, and so we ate vegetarian food. And I played basketball or tennis or squash or whatever, wherever we lived. I felt, early on in life, 20s, 30s, quite fit and healthy. It wasn't something that I really thought about because, I always had kind of an interest in it, but always knew, look, I'm playing sport once a week or I'm eating, vegetarian food, I'm fine. And I felt fine. It was around 2005, 2006. And at that time, my two daughters, who are the oldest kids, they were working for Baker's Delight after school. And they would bring home freebies all the time. And so I'm a bit of a sweet tooth, and so I started to eat more than I normally did. And so I wasn't exercising either. And I never got sick. I can tell you probably the number of times that I've been to a doctor for being sick, and I reckon it's less than 20 in my whole life. And at that time, no, I didn't even have a doctor. Was going to go to Mongolia on a mission trip, and I was leading some people on that trip, and we had to have a health check and get immunisation, and just to make sure we're up to speed with all of that. So I went to a GP, and he asked, who's your doctor? And I said, oh, it's you. And he said, well, you haven't seen me and you've been here around for a while. And I said, yeah, well, I don't need a doctor. And he said, oh, well, I'll just give you a bit of a check, seeing you haven't seen one for a little while. He said, I've got to talk to you about your health tests. And I go, oh. And you kind of go, whoa, what's all this about? And he says, well, your cholesterol's really high, you're overweight, and you're not really fit for somebody your age. You need to make some changes.
Later in the show, we'll see if telling a guy who thinks he's fit but he's not is the right medicine to make him change. We have an expert cardiologist to tell us about atrial fibrillation. Melinda's in the kitchen making us cookies. And first up, the news. In the headlines, genes in the heart, artificially sweetened drinks linked to heart disease, and genes determine the value of fish oil supplements. A genetic study of 413 American adults who had unexplained sudden cardiac death was undertaken over the span of 20 years. Gene testing was done looking for inherited cardiac diseases that it might explain the cause of death and enable surviving family members to benefit. Researchers found Although normal cardiac findings were seen at autopsy, 20% had pathogenic or likely pathogenic genetic variants consistent with inherited cardiomyopathies or arrhythmia syndromes. These were predominantly associated with hypertrophic cardiomyopathy, dilated cardiomyopathy, and long QT syndrome. This suggests new avenues of study would be beneficial for this poorly understood entity. Daily consumption of sweetened drinks is associated with an increased risk of cardiovascular disease, according to a large nutritional study in France following 100,000 people for 10 years. Cardiovascular events like stroke and heart attacks, acute coronary syndrome, and angioplasty were increased by 20% by one sugary drink a day and 32% by one artificially sweetened drink a day, suggesting these are not the healthy substitute they're marketed to be. Sugary drinks have been linked to cancer, weight gain, type 2 diabetes, high blood pressure, asthma, and tooth decay. Artificially sweetened drinks don't appear to have the cancer link, but they disturb gut microbiota and are linked to type 2 diabetes and metabolic syndrome. So let's go for the safest drink of all, water. In recent years, science has begun to question the long-standing advice to eat oily fish or to take omega-3 fish oil supplements to improve blood lipids and heart health. Several large meta-analyses have found little cardiac benefit from taking these very popular supplements. So why the conflicting results? A new study suggests it might all depend on your genes. If you have a specific genetic makeup, then fish oil helps to lower blood fats. But if you don't, fish oil will actually increase your blood fats. So across the whole large population, they don't appear to help. I'm Dr. Nerida McKibben, and that's today's health news. Our guest today is Dr. Martin Stiles, cardiologist and electrophysiologist who specialises in heart rhythm disorders. I asked him to tell us about the arrhythmia called atrial fibrillation.
So atrial fibrillation is probably the most common sustained rhythm problem that we see in adults. And it affects about 1% of 50-year-olds and about 10% of 80-year-olds. So as you age, it gets more common. And we're seeing it more and more commonly in the hospital because it's associated with things like diabetes and high blood pressure and obesity, sleep apnea, all those sort of things that we're seeing more of give us more AF. So we're seeing a lot of it in the hospital.
Mm. So why is it important? Why is it something that we don't want?
Well, it can increase your risk for a stroke, and nobody wants a stroke. So one of the things we talk about it to people with AF is their stroke risk factors. We may put people on anticoagulant drugs to prevent that. Sometimes it makes people's heart go really fast, and we need to slow it down. And it's often quite irregular. So people feel palpitations, they feel a bit breathless, maybe even chest pain, some of them even faint. And so, we need to slow it down and prevent that sort of thing.
Yeah, because fainting when you're older means you break something on the way down.
Can do, yeah. And their quality of life is sometimes impaired with this rhythm problem.
Mm. Does it put them at risk of heart disease, dementia, and even death? Or?
Yeah, so it's associated with an increased mortality. In itself, not a life-threatening rhythm disorder, but it keeps pretty bad friends, the blood pressure, the diabetes, the heart attacks, the heart failure. So yeah, it is something that we can try and help. One of the important things that we've learned is to try and modify lifestyle factors with atrial fibrillation, something we didn't actually know until quite recently.
Okay. So how did we learn that?
So one of the ways we learned this is through animal models. So when I was in Adelaide, my colleagues there had some sheep that they fed fat-soaked grain to. And some of these sheep got to about 100 kilograms. And the ones that they didn't feed it to were about 40 kilograms, right? But these really fat sheep, they got atrial fibrillation really easily. We did ultrasound tests on them. We did electrical tests on them. We scanned them. We couldn't scan the really fat ones because we couldn't put them in the MRI scanner, even if you push really hard. So it's fascinating when you work with sheep because you have to transport them in pairs because they're a herd animal.
Oh.
Yeah. And so you have to take them to and from the MRI scanner in pairs, unless it's your last sheep. in which case you have to transport it with a mirror. It's true.
I had no idea, and I used to keep sheep.
I'm sorry, digressing from the topic. I'm sorry. Yeah.
Well, yeah, I had a herd. They were quite safe.
Anyway, they were treated well, these sheep.
Yep,
but
obviously.
But ultimately, they did tell us that obese, large mammals get AF.
Wow.
So now they've taken this a bit further, and on their human group, so patients who are presenting with atrial fibrillation, those that are obese, and the group that they use with a BMI over 28, so not
Which
that
is
obese.
not very high.
Yeah,
Yep.
but some of them were quite large.
Yep.
And they tried to get these patients to lose weight, and they were actually quite successful in a good number. And what we learned from that is that if they can lose weight, some of them were booked for a procedure, and because the waiting list was 6 months, by the time they came for their procedure, they didn't actually need it. Those that did go for their procedure, we knew that those that didn't lose weight, they kind of needn't have bothered having the procedure because the outcomes down the track weren't so good. The AF came back.
Oh, so you could get rid of it at the time,
But ultimately...
and even without them putting more weight on, the AF would just creep back in.
But those that lost weight, in addition to their ablation, they did really well. So 90% success rate.
And did you find this with the sheep model too? We did find that with the sheep. So we actually got these really large sheep to lose 30% of their body weight, which is super easy with the sheep. You just restrict their calorie intake and down they go. And a lot of the changes that we saw regressed, which gave us the impetus to do that on humans, to really get there and concentrate on the lifestyle factors. So get their blood pressure down, control their diabetes, lose weight, stop smoking, treat their sleep apnea, get their cholesterol down, more exercise, all the sort of sensible things that people know to do. But I think if you have a heart problem and you tell someone about it and you say that, you know what, this is critically related to how you're living your life, that gives them a lot of motivation to do something about it. Yeah, and then you gave them the means, the methodology to do it, and you walked with them through that? Yeah,
and it's not a one-size-fits-all approach. So some people will respond to some things, restricted time eating. Some others will like meal replacements with shakes. Some others will like portion reduction. You have to tailor it for the person. And also the exercise, definitely tailored for the person. Some people hate to run. Some people love to swim.
Yes, some people like group classes.
Group classes, yeah. Other people are individual. So, you have to tailor it to the person. And one of the most simple things that they did was every Sunday night they had to email the weight loss clinic to say what had happened. What was your weight this week? And they'd get a simple email back saying, well done, Gary. It's good to see you lost a bit of weight. Shame about Thursday night when you slipped up. Keep it up for next week. Just simple stuff.
And that was effective.
It was effective, not for everybody, but for a good number. Enough for them to show that if you did these things, your outcome from atrial fibrillation was much improved.
If you have atrial fibrillation, you can do the same to improve your outcome. After the break, Melinda has something very scrummy that she'll show us how to make, so stick around.
It's time to make something sweet. We're going to make macadamia and rice malt syrup cookies. These are incredibly delicious. With the macadamias, these ones I've actually bought all the way from the Byron Bay Shire. A friend of mine gave them to me, so they're local nuts. And they are a little bit high in calories, but I always say that calories shared are half the calories. So make sure this cookie batch is to be shared, not to be just eaten by yourself. So just to start with, I think we might chop these macadamias. Just really rough chop. We don't need them to be in little pieces. It's much nicer to find a big chunk of macadamia in your cookie than to miss it because it's all in powder. There we go, our macadamia's all chopped. We're going to make a flaxseed egg, which is kind of an egg, it's an egg replacement. Made with flaxseed. Flaxseed is really, really high in omega-3s, and omega-3s are fantastic for your heart. So we're just putting a couple of tablespoons of ground flaxseed into 4 tablespoons of water. And you can see that it's already becoming quite thick. It gets quite thick fairly quickly. And while we're just going to let that sit just for a little while, And into our mixing bowl, we're going to put our almond meal. So this almond meal, you can see it's quite brown. So it's been made with almonds that have the skins on, which means more fibre and more antioxidants. But the flavour is exactly the same. So keep the skins, I say. And into that, we're going to put some baking soda, just a little bit, and stir that through. And now that our flax egg is sat for a little bit, it's actually gotten quite hard. You can see it's quite thick now. We're going to add to that about a teaspoon of vanilla and about 2/3 of a cup of rice syrup, which is a fair bit, but this is the part that sticks the cookies together. So now we just mix those three things together. Try to get all those little lumps out. Okay, leave that to one side. We can put our macadamias into our mix. We're also going to add some chopped dates for a bit of extra texture and also for sweetness. And some shredded coconut. And just mix through. These cookies keep for quite a long time out on the bench. They're not a really crunchy cookie. They're more of a, like a chewy cookie, but really, really tasty. Now we're just going to mix all of that through, and it's going to come together to make kind of a sticky dough. See if we can get a bit more of that in there. Just want to get all those little dry bits off the bottom. Make sure they get mixed in with our dough. It's a very sticky dough, but it makes great cookies, so it's well worth going through it. Just keep pressing it down, and you should finally end up with a bit of a ball, a big cookie dough ball like that. And what we do now is we just kind of break off, depends on what size cookies you like. I kind of do, I don't know, probably about a tablespoon size. Just sit those on your tray and then press them a little bit flat. And just keep going until you've filled up your tray, and then we need to put them into a preheated oven for about 15 to 20 minutes, about 170, 180 degrees. And here we are, our chewy macadamia nut cookies all finished. They are so yummy, they smell so good. When you break them open, oh, do you know what they're perfect with? A glass of almond milk. So good.
Gorgeous golden gluten-free cookies. Now back to Glenn. He knew he didn't need a doctor because he was fit and healthy, right? But for a mission trip, he went for a health check and immunisations. Boy, was he in for a shock. The doctor told him he was unfit, overweight, and had high cholesterol. What would motivate him to make the changes? Let's find out.
My grandfather had his first heart attack at age 42. And I think I was 42 or 43. And that kind of resonated in my mind. And he changed his diet as well. He was eating lots of fats and other things, and a bit of a sweet tooth like myself. And that was his only heart issue ever. And he then began to walk and then jog every day. And I said, well, I got to do the same things. And so our diet, like the walking happened, but walking's kind of low impact and it wasn't really bringing my weight down. And I've always had a bike, and I had some friends who were into mountain biking and others into road cycling. And I'd go for the occasional ride with them. And I thought, well, hey, I'm not doing any sport anymore. I'm not really that active. So I said, yeah, why not get into cycling? And yeah, that's where I got myself a mountain bike and a road bike, and started joining my friends cycling, and I saw the weight come off. And I came back to my normal weight when I was married. And I have been around that weight from about 71 to 75 kilos since then. And also in that time, Pam got a lot, interest in health, and started to change our diet. And we were always vegetarian, always plant-based, but we've become more and more so. And I've found the benefits. I feel much healthier. I love the walks in the morning. And you can see from my t-shirt, cycling, it's not just good for my physical health, but the other thing that I find is my mental state. It clears the mind. And I've been back to a number of doctors since, many times, asking them to check my weight, my height, my lung capacity, my blood and functions and all of that. And I don't have an issue with cholesterol. I am super fit for my age. And I just thank God for the opportunity to be told to change, because I knew all along these principles and I didn't really care about them, although I sort of followed them. But the older you get in life, the more impacts, you do age and whatever, and following the health principles have really been a benefit to me.
Of benefit too are some key elements of treatment for atrial fibrillation. Here's cardiologist Dr. Martin Stiles to explain.
Yeah, if you can lose 10% or more of the body weight, which is a significant amount, and keep it off, then your chances of the atrial fibrillation coming back are less. Moreover, we know that the studies tell us if you can lose it in a linear fashion, that is, you can go down
just slow and steady.
Slow and steady, you do much better than the fluctuators. The ones who
yo-yo their way down.
They yo-yo their way down, and they don't do as well. And it's kind of common sense, isn't it? But it's kind of nice to see it studied scientifically, and the outcomes, that's what you thought it was.
Right.
It gives you a lot of confidence when you're counselling patients.
That's right, because this is more metabolically correcting, isn't it, than the yo-yo where you're metabolically up and then you're metabolically down.
And what's really fascinating is we've found that the fat around the heart's really important. The fat around the heart seems to influence the heart rhythm. Really important work coming out of Otago and Auckland about that. Yeah.
Now, this organ fat, because we get it around our kidneys, around our liver, around our hearts when we're overweight, or if we're eating highly processed foods, raises inflammation. And do you think that's what
what's really interesting about the fat around the heart is that everywhere else in the body, when you get extra fat, it's the fat cells getting bigger, what we call hypertrophy. Around the fat in the heart, it's about hyperplasia, lots more cells of the same size. And you can imagine easily how that could be more metabolically active because of extra cells all working in the same way to influence the heart. Some fabulous work coming out of Dunedin. There's people having cardiac surgery. Somebody goes across, takes a little bit of heart muscle from the cardiac surgeon. It would otherwise be wasted. They would throw it away. They run across the road with it. They can reanimate that little bit of heart tissue in beats in a saline bath. And you can run all sorts of things through it. You can take some of the fat tissue, run some saline across the fat tissue and through the heart, and it changes what it does. So this fat tissue is metabolically active and influencing the heart rhythm. So really fascinating things, and tying in with the whole lifestyle thing, right?
Yeah.
If you can reduce your fat, especially around your heart, you can improve your chances of staying in normal rhythm.
So do you think that when you're yo-yo losing weight, you are not impacting, do you think that you're perhaps
Maybe.
not impacting that cardiac, pericardial fat as
Yeah.
much as if you're doing this steady
I guess so.
loss? I'm curious now.
That's a good idea for a study.
Yeah. Now, I've read that for atrial fibrillation, exercise has a U-shaped curve.
Yeah, right.
Explain that.
Okay, you've been doing some research, I can see. So, yeah, it's really interesting that people who get atrial fibrillation on your couch potatoes, if you then get them to exercise, their chance of AF go down. But for those who really hit it hard, those are the Ironman, the rowers, the cyclists, the cross-country skiers, those sort of people who are really pushing it, they can actually exercise their way into atrial fibrillation. It's fascinating.
So moderate exercise is the key?
Moderate exercise is the key, yeah. Everything in moderation.
Even moderation.
That's right.
What would you choose, lifestyle changes or ablation? In the next segment, we explore what those changes might include, so don't go away. Now it's time to tackle some of your questions. Paula asked, is there a treatment for vitiligo? Well, vitiligo is an autoimmune condition in which the cells that produce skin pigments are attacked and destroyed by your own immune system. Stress will affect how the immune system works, so managing stress is really important. Vitiligo tends to happen more in exposed skin, so always use at least SPF 30 sunscreen and shield the damaged skin from sun exposure because it can't tan, it just burns. Avoid getting tattooed or damaging the skin because damaged skin will trigger new patches. Standard treatments for vitiligo include steroid creams and calcineurin inhibitors that are in creams and ointments. And then, believe it or not, light therapy with UVB rays works to suppress the immune response and to stimulate cytokines or growth factors to help reverse. There are a number of herbal products that have been tried, some of them orally, but mostly as creams, and in creams that combine with UVB light therapy. Those herbals include sorrelin, ginkgo biloba, muskmelon, callan, green tea, polyphenols, capsaicin, and curcumin. Now, some people found help with alpha-lipoic acid, folic acid, vitamin C, and vitamin B, but you want to talk to your skin doctor before you use any of these alternative things. Margaret called, I have muscle atrophy and my skin is thinning and becoming sensitive even to heat. Are there foods or other things I can do to help? Well, you might want to try foods that are high in vitamin C, like citrus, bell peppers, or capsicum. They can help. Also, nuts and seeds and tofu. And then there's vegetables and legumes that have been shown to help with this problem. And you might want to add omega-3 oils to your diet. You might want to pour some flaxseed oil on your foods on the plate, not in cooking, because omega-3 oils do denature with heat. Thanks for those questions. If you have a question, then send it using the contact details on the screen. Now let's head outdoors to see what's on offer at the fruit and veggie stand. Bell peppers, sweet peppers, or capsicum, as they're called in different parts of the world, come in all shapes, sizes, and colours. I'm sure you're familiar with the orange, green, red, and yellow ones, but they're also naturally grown brown, white, and purple. Green peppers will often ripen into the other colours, and there are more phytonutrients in the riper fruit, especially the orange and the red. These bright colours signal the presence of beta-carotene and lycopene. A large red pepper contains only 50 calories and 3 times as much vitamin C as you'd get from an orange. They are delicious, baked, broiled, roasted, or stir-fried and served with brown rice. Of course, significant amounts of vitamin C will be lost with cooking, so be sure to eat it raw whenever you can. They add so much crunch and colour to any salad. Bon appetit. We're talking today with New Zealand cardiologist Dr. Martin Stiles about atrial fibrillation, or AF, a common heart rhythm disorder. In the last segment, he mentioned that there were some lifestyle changes people could make that would make the AF medications more effective and avoid invasive treatment. I asked him what people with AF should do to try and improve their situation.
The most important one are the anticoagulants that I mentioned. If someone's got a high stroke risk, it's really important to protect them from that. So that's often the first discussion we have, is about the stroke risk. And then when we talk about the drugs for the rhythm itself, we want to give them drugs to make sure the heart doesn't go too fast, because we know if someone's heart remains very fast for a long time, that can be quite bad for the heart. So we slow them down a bit. And sometimes we give drugs to try and promote a normal rhythm, to get them back into what we call sinus rhythm. And if people maintain sinus rhythm, then they may feel better. Now, if those drugs don't work, or they have side effects that the patient doesn't tolerate, we may discuss with them an ablation.
Okay, now that's something you do. So walk us through an ablation procedure.
So an ablation is where we make punctures in the groin, in the vein in the groin, and we put wires up into the heart, usually 3. And a couple of those wires go from the right side of the heart, where we end up from the groin into the right side of the heart in the vein. And we pop across into the left side of the heart. We make a little puncture very carefully into the left side of the heart.
I'm glad you're doing that and not me.
We have a number of checks. We have 5 checks to make sure the needle's going in the right place. Let me tell you, it's one of the parts of the procedure where everybody's concentrating pretty hard.
Yeah.
Once we're in the left side of the heart, we give some blood thinners, because we don't want any clots to be around. Blood clots on the left side of the heart can be bad. They can cause a stroke. So we're meticulous about that. And we target the pulmonary veins. Now, the pulmonary veins are coming into the back of the heart, taking blood from the lungs. So this is bright red blood, freshly oxygenated. It's coming to the heart to be pumped around the body. And they're doing a really important job, those pulmonary veins, as tubes. But they also set up some rogue signals that can cause atrial fibrillation. So we target those rogue signals, get rid of those, leaving the tubes open, because that's important.
Yep.
And then hopefully rendering the patient free of atrial fibrillation.
So how do you target that, or how do you ablate those
You've got a couple
signals?
of choices. You can burn it, what we call ablation, or cauterizing with radiofrequency energy, or you can freeze them. So both are legitimate approaches. They both have pretty similar effectiveness, pretty similar safety. I can do either of those. We learnt with the burning, but more recently we're doing the freezing.
So, and what's your preference, and why would you have a preference?
My personal preference is to do the freezing for the patients with brief episodes of atrial fibrillation coming for the first time. But if they need a second procedure, or sometimes when somebody has more complex rhythm issues, we'll use the radiofrequency, simply because the radiofrequency is a little more flexible if you see something a little unusual.
Okay.
Yeah.
Whole procedure takes how long?
Well, they used to take a long time. When I was training, it was 4 hours, and, it was pretty hard work. I've done procedures up to 6 hours, and that's tiring.
Wow.
Nowadays, it's coming down quite a lot. So you'd hope to get it through in under 2 hours. Certainly with the cryo procedures, we can do it under an hour if everything goes well. But I think it's important to do it properly rather than quickly.
Yes, yes. And recovery time?
And, they stay a night in hospital usually. We do some day stays. I had a patient last week stay a couple of nights just because she was a little uncomfortable. But yeah, it's getting easier, quicker, and more simple for the patients. But it still is a significant thing to do, and it carries some risks. So when we're talking about the procedure, we say, look, these are the drugs that you're taking. They're doing an okay job, or they may not be doing a good job, who knows. But we'll contrast that with the ablation, which again, the outcome's uncertain. We have about a 70% single procedure success rate, so it's not 100%. Some of those people need a second procedure.
And with a second, what would the success rate be?
And we get up to the sort of 80 or more percent.
So you're still not at 100%.
Yeah, that's right. And that may be because of other things that are going on in the person's life, the obesity, the high blood pressure, that sort of stuff, or it may simply be because they're a bit more complex than others. But we would contrast the success of their drugs or how that's going with the success of an expected success of a procedure, and the complications. Because, of course, complications happen with any procedure. So you have to be upfront about it and say, look, this might happen.
What might those complications be when you're counselling?
Yeah, well,
just
the
your
obvious
typical
one's
patient?
bleeding from the groin. We're making a puncture here, so we want to avoid that. But ultimately, hopefully, we just put our finger on the puncture site for a while and it stops. But you can have quite nasty bleeds.
Yes.
Bleeding from the heart's really important. It doesn't leave the body because the heart's contained within a sac, but if there's a sufficient amount of blood within that sac, that can be a problem because it pushes in on the heart. So we might have to drain that off with a little needle underneath the breastbone. Patients sometimes even need to go to surgery. But the one I worry about most is stroke. Now, the risk of stroke's really low. A stroke or a mini stroke would be a risk of about 0.6%, but that's still significant.
Yeah, nobody wants a stroke.
No.
Yeah.
And the risk of dying from the procedure, about 1 in 1,000. Now, that doesn't sound like much, but it's a lot higher than we'd like.
Yeah, it's hard to live with when you're having to do the procedure. It's
Yeah.
probably a much safer option is to do the lifestyle changes, right?
That's right. Exactly.
Success
So I
rate.
put that to the patients. I say, we could do this or this. You know, if you could only achieve these lifestyle changes, these medications may become more effective. But if that doesn't work, then there's an ablation as well.
In the last segment, we'll discuss what practical things we all can do to prevent getting AF in the first place. Don't miss it, but first, let's take a fresh look at the heart. If we were to read a different Bible verse that mentions the heart every morning and every evening, it would take more than a year to read them all. That's how interested God is in the condition of the human heart. But he's not referring to the physical heart that pumps the blood around, but the spiritual heart. That's the core of who we really are. It represents our desires, our will, our reason, and our feelings. While our conscience or God's Spirit tells us what is right and what is wrong, the heart makes the choice. A heart that's surrendered and connected to God will make the right choice every time. But a carnal, self-serving heart will not. And if you're tired of your self-serving heart and you want to trade it in John chapter 3, Jesus told Nicodemus that it was possible to do that by being reborn. And that new birth is on offer today. Are you ready to do a trade-in? We've been discussing a common heart arrhythmia today called atrial fibrillation or AF. There's an interesting observation that doing too much or too little exercise increases the risk of getting it. I asked today's guest, Dr. Martin Stiles, to explain.
People who have a small amount of exercise have a lower risk of atrial fibrillation compared to people who do very little. So it's important to exercise. But what we do know is that high-performance athletes can develop atrial fibrillation. And it's really interesting. It really depends on the sort of exercise people do. Cycling and rowing are the ones that I see, particularly in New Zealand, when we've got the rowing centre and the cycling centre just down the road. And we see people who are doing high-intensity exercise with big muscle groups for long hours during the day, and they get atrial fibrillation.
Even at young ages?
Even at young ages, yeah.
Because originally you said that, 1% of 50-year-olds might have AF.
Yeah.
But these sort of super athletes could even get it younger than that.
20s and 30s, that's right.
Wow.
But the other group that we see are the middle-aged men in Lycra, you know, the cycling guys that you see on a Saturday, Sunday morning going around the country roads.
Weekend
because
warriors.
they have both age and exercise. And over their lifetime, they may have accumulated 2,000, 3,000, 4,000 hours of intense exercise. And when you get up into those sort of levels, you do see a lot more atrial fibrillation, which is really interesting. Trying to manage those people is difficult because exercise is part of their life. Everybody sees exercise as healthy. They think more exercise is better, but there gets to a point where they're exercising their way into a rhythm problem. So we try and get them to peg it back a bit. And also they don't like some of the drugs that we use because it impairs their performance. So those are the people who are more likely to go for an invasive procedure like ablation.
So that they can get back out there.
So they can get back out there.
Yeah.
Yeah.
Okay.
It's surprisingly common. You talk to the guys, they will say, you know, where's John today? He's normally up the front. Oh, John's at the back, you know, getting a tailwind from everybody else.
Yeah.
Because he's got AF today.
Okay.
Yeah.
I thought it was going to be because Martin put him on some drugs.
Well, maybe because I put him on some drugs. That's right, maybe you're right. But then he gets an ablation, he's up the front again.
Oh, okay, great.
Yeah. If only.
Back to see Martin. So what, and thinking about drugs, what about alcohol smoking?
Yeah, really interesting
drugs?
research come out of Melbourne. They got 140 patients with atrial fibrillation who were moderate drinkers, and they asked 70 of them to abstain from drinking and 70 of them to continue what they were doing. Both groups reduced the alcohol, but the abstinence group markedly more than the non-abstinence group, and the AF burden, so their AF over time, the frequency of the events, the duration of events, they were markedly reduced in the group that tried to abstain. And that's about as good a data as you're going to get, isn't it? Because it's difficult to randomise people.
Right.
But these people got education to reduce their alcohol intake. So that's pretty good data that we have, that alcohol is really important.
It's hard to make an Aussie reduce their alcohol.
It possibly is, right? That's right. And so, you know...
And what about smoking?
And smoking's also important. But the alcohol thing's really interesting because you know about the cardiovascular paradox, that a little bit of alcohol seems to be better than... seems to be actually good for the heart, but a lot seems to be very bad for the heart. With atrial fibrillation, it's not like that. Mm-hmm. It's a straight line up. So we actually counsel our AF patients to limit their drinking, stop if they can. It's a well-known phenomenon, the holiday heart syndrome. People go away on holiday, they drink a lot more, they can get atrial fibrillation.
So it's not about being on holiday, it's about being on the bottle. After many years of staying away from doctors, 40-something-year-old Glenn had a checkup and was jolted into reality by being told he was unfit, overweight, and that he had a high cholesterol. His grandfather had had his first heart attack at 42, and so Glenn followed in his footsteps to remediate his lifestyle. Here's another aspect to consider.
Now I think I'm doing my best to treat my body as the temple of the Holy Spirit. You know, God dwells in me and He can help me, and He can help me, you know, when I'm overweight and when I'm unfit and all of that. But when you are fitter and healthier, it's so much better. Yeah, the difference is the clarity is always there when you eat well and when you exercise. Because sometimes when I travel, I have to eat other things and I don't get to exercise, and I can feel what's happening to my body, and I don't like it. The thought of my grandfather and remembering his story, and the fact that I had been quite active a few years earlier, and I had always enjoyed being active, and I didn't want to, you know, nobody wants to really die early and die unhealthy or anything. And so I said, yeah, I did. I just made a decision. I am going to be healthier and fitter. And yeah, just went to it. It's a discipline thing. I've just learnt that it's a priority, and long term, if you want to function better, you keep the health habits just as part of your life.
So true. And with that, we can significantly reduce our chance of getting AF as we age. Losing weight, not smoking, and not drinking are all achievable goals that could save us having to struggle with heart disorders. If weight loss is your challenge, now is the perfect time to tackle it, just like Glenn did. Get a buddy, follow a meal replacement plan, or find what works for you. And don't forget to make regular, moderate physical activity another healthy habit. That's all from me today. Thanks for joining us on Go Healthy for Good. I'll see you next time.